Hey, good afternoon, everyone. My name is Don Saucier. I'm Deputy Chief of Patrol Operations with Tulane University Police Department. I'm happy to see that we have so many participants on here today. We're here to speak and try and answer questions of anyone that may have them of the incident that happened with two Asian students where they were threatened and I guess scared, very well scared. But we have several people on line today to help answer any questions. We want to correct any rumors you may have heard or make sure that you have the correct information as to what we're doing, how we address the situation, and what you can expect to see from us in the future. And with that, I'll let the rest of the panel introduce themselves.
Tom, you want to start with you?
Yeah, hi, I'm Tom Augustson, Director of Operations and Faculty Affairs for the School of Public Health and Tropical Medicine.
Hi, I'm Susan Barrera. I'm the Assistant Dean for Finance at the School of Public Health and Tropical Medicine.
I'm Sue Pollack. I'm the Assistant Dean for Administration and Operations at the School of Medicine.
Hi, I'm Arturo Rodriguez. I'm Assistant Dean of Finance and Administration for the School of Social Work.
I'm Captain Maurice Trosclair. I'm the Downtown Medical District Commander for Tulane University Police.
Okay. Thanks everyone for joining us again today. This is a little bit of a different town hall than we've done in the past. This one is on safety and security around our campuses. So a lot of my questions will be directed sort of largely at the panel at large as opposed to individuals. And please remember to send us your questions that you have specific questions on to the chat room if you're on Zoom or on Facebook Live. Let's go back to the issue that we sort of started with, which is about our employees of Asian ethnicity and international students and scholars that feel threatened during this time. What is TUPD doing specifically in cases and these types of cases of racial bias or xenophobia to help protect our students? I don't know if Donald or Maurice want to take that.
I can answer for the overall. We will conduct a thorough investigation. We have people that are working on this now. We're also working on that one in conjunction with NOPD. I believe they have put out a bolo of a person of interest on it as of now. There's no identification yet made, but they are working on that. And we've also instituted several other working patrol operations. I'm going to let Maurice run up on because he's basically he is over that area and he's been monitoring all the situations there. So, Maurice.
All right. So I did want to actually talk a little bit about just department-wise how we train for bias. Everybody in the entire police department within 30 days of their employment, they have to go through a 2-hour bias identification training. It's fairly thorough, and then yearly we do have a bias class in our in-service that the officers are required by Louisiana Post to participate in. So the officers do receive training on identifying bias crimes and how they are different than regular crimes, even if the actual mechanics of the crime are the same. So,
and let me jump in just for a second. We do have 3 different policies covering these issues that the officers also every year on in-service training are trained on. And they're trained by some in-house Tulane instructors as well as outside agencies we bring in to go over these issues.
So as far as this district, which is the medical district, and many people may not be aware that we actually do patrol from Claiborne to Rampart, and then we patrol from Canal all the way to Poydras. So while we don't have full jurisdiction in those areas, we do patrol those areas. So you will frequently see Tulane police cars and officers patrolling. Now, like the bias incident that occurred on the 7th, that one actually was taken over by the New Orleans Police Department because it did actually occur outside of that boundary. So they are going to be the primary investigating agency for that. But we do work with them, so they will give us information and we can pass it on to the community to make sure that they can make the best choices about walking between buildings and whatnot. So what we've done, we've instituted a visibility initiative. And basically what that entails is every single hour, a police officer is going to go out to the area of Tulane and Claiborne with the lights on the police car on and dwell in the area for 5 or 10 minutes as a deterrent to crime. And then during the time that the incident actually occurred, they're to sit out there for 30 to 40 minutes and be visible. Now, it could be a police officer on a bicycle, or it could be a police officer on our trike, which is a 3-wheeled electric vehicle, but it's got lights on it and it says police on the side. It's actually pretty neat. But you'll be seeing those around the campus, and it's a pretty efficient patrol method that we've just adopted. So other than that, we still have 24/7 escorts. We can use Everbridge as a virtual escort if somebody didn't feel like they needed as much as a police officer in a car to get them from point A to point B. I know that when there's an incident like this, it seems like the climate is much worse crime-wise, but if you just can back up and look at the statistics, this campus is getting safer. There's another event we're compiling data for the department. It's actually for the medical school, and over the last 5 years, crime is decreasing on our campus. It is getting safer every single year. So yes, right now this is an unpleasant situation specifically for this demographic because of the COVID issue. It is getting better. I want everybody to know that it is getting safer on our campus, but it's just less safe right now for this demographic, which is why we're doing visibility, extra patrol, extra escorts. And if anybody is even slightly concerned about their safety, they need to call us.
Thank you. And I would just remind everyone that tomorrow at 1 o'clock, we have another town hall specifically on bias issues. So we'll have more information just on that generally in the community tomorrow. But I don't know on this particular issue if anyone else wants to weigh in less on the sort of the TUPD side and on the other side right now, if Susan or Sue or anyone has anything to add.
I want to make sure that the community feels comfortable that they have various ways to reach out. They could reach out directly to TUPD. They can certainly go to their immediate supervisors or the chairs. I know Dean Ham, and I'm sure the others from the other schools will speak, that he is more than willing to get an email from someone who is concerned about these kinds of incidences on the campus, as well as overall security. So people should feel like they have various ways to report concerns.
Yes, the same goes for the school public health. Dean Levy or any of the other deans would be more than willing to or happy to talk to you if you have concerns or issues. Please feel free to reach out to us at any time.
The same thing for the School of Social Work. Dean Bordnick has expressed the fact that he will email, even sometimes phone call with anybody that wants to communicate with him and report anything.
And Susan and Arturo, are there, most people think often of the School of Medicine when they think about downtown, but obviously we have multiple schools downtown. I don't know that there would be any issues that are specific to your schools, but are there specific concerns that you all want to share that you hear from your students and faculty?
Arturo, you can go for it.
Thank you, Susan. I think, being in the same community, being in the same area, we kind of share all of our concerns. So I don't think we have unique, and in the school social work, we don't have any unique issues. We share them with the School of Public Health and the School of Medicine. An incident against any student or faculty or staff again in those schools, it's also something that we would care about and want to ensure that it does not happen to anybody. So no, I do not have any. I don't see any particular special needs for us.
Yeah, I think the same for us. Although, you know, a lot of students, graduate students, are still in New Orleans. They haven't left town, and there are plenty that live in Deming, right? So, so we do want to make sure that the area around Deming is secure, and those students, when they do have to get out, that it's a safe environment for them. You know, and if not, if there are issues, then please let us know. You know?
So that actually leads me to the question about with the fact that people, we think generally there are less people downtown right now. There are less people downtown. Is TUPD still providing the same coverage to the area that they typically do when we have a full complement of students and faculty?
Yes.
Absolutely.
Go ahead.
I can jump in there. So we evaluate our patrol patterns on a weekly basis with different crimes, and we look at where we've had reports of different issues. So with a lot of buildings that are at reduced capacity or completely closed, we are altering our patrol patterns. We're doing a lot more interior patrols because unfortunately the criminal element also realizes that these buildings are empty, and we want to make sure that nobody's getting in to commit opportunistic crimes. So other than that and the extra patrols and the visibility initiative, we're still covering the same area. We're just doing it a little bit differently.
I think we've reached our numbers that we were looking for in the night watches there, especially downtown, with officer wise, as well as moving allied people around to certain other duties to make sure we cover everything that in the spots we need.
Sounds good.
So I see a question that just popped up on the chat about extending the TU police perimeter. We wouldn't really extend our patrol perimeter, but we do provide escorts outside of that perimeter as long as it's within reason. Obviously, we're not going to drive somebody to the airport, but if it's 2 blocks outside, then yes, we will provide that escort.
It's not up to us to increase the perimeter. That's something that's in the MOA with the city of the area that we patrol. So that's set up by them.
Okay.
For all the school reps, is there anything that your schools are doing differently during this time?
I would say no for the School of Medicine. While we have many people are at home and working from home, all of the buildings that have research labs are active and functioning, and the labs are full of people. So we need to make sure appropriately social distancing full of people. And so we feel like things are almost normal from that perspective, and don't want to do anything differently other than be sure to encourage people to be thoughtful with the social distancing.
Yes, I think you're right. I think only one of the other minor changes we've looked at is how, you know, deliveries are made and others enter the building. So I think as long as we can control that, our building as well as operational, it has more individuals in it than just the school public health.
Right.
So we have
all of the clinical operations that are out there are also requiring basically the same amount of security support. And I think a lot of people don't realize there are clinical operations in every building.
Right.
I will say that in public health, there are a couple of clinics and research clinical studies that have stopped bringing in people from the outside, non-Tulane folks for those studies. So I feel like that's probably been an element that we can control a little bit more in the school. Yes. Without having the public come in at this time.
Yeah, and on the school social work, we've told all of our faculty and staff that if they go in, to ensure that they report themselves to the first floor security person, and also to email one of the executives or even the dean's assistant, so that we know who's there and at what time. And it's worked nicely, and the building is not closed. people can go in, and I myself have gone in, but it's important for us to know who's there and at what time and when do they plan on leaving. So that is something we've instituted.
So people don't need special permission to enter their buildings, is that correct?
No.
If they have regular access, then during the regular year, so yes, they can go in.
Right. So what are we doing to protect the health of our officers that are on the street and patrolling?
Maurice, you want to let that one go? You working them down?
I've had a just impossible amount of conversations about masks and personal protective equipment over the last couple of months. So I don't know if I'm an expert in it yet, but I can at least speak a little bit intelligently about it. The CDC puts out guidance for first responders on what type of protection they should wear and when, and we follow that. It really depends on the situation, but generally it's N95 masks or a level 1 mask and gloves. We do have packs of specific PPE if officers have to go hands-on with somebody that's COVID suspected or COVID positive case. And we extend this to the Allied Universal Guards also. If they're in a working a post where they require that PPE, we supply that to them also.
And we've been impacted by it as well. Over the course, we've probably had off and on several positives and some people out with exposures, but we've been able to work around that, make sure we're fully staffed, canceled vacations, did numerous things to make sure we stayed full staff. So we haven't been shorted yet.
Are the rules for like PPE the same for the allied health folks as it is for TUPD?
Yes. Well, they're not, I don't know if they're in the back as much as they were, Maurice. I'm not sure.
So, you know, the recommended PPE depends on what you're doing. If you're just walking around in public, there's currently not any recommended PPE for first responders. But in the hospital, there are certain levels we have to wear depending on the area of the hospital you're operating in and what you're doing. And that has changed as this event has progressed.
Well, the governor and the mayor are asking people to wear PPE whenever they're in public spaces and continue social distancing. So if somebody sees somebody not wearing PPE, is that a reportable offense or just?
No, none of that's enforceable by law enforcement. And I don't, you know, it is important that everybody is mindful about what their neighbors are doing just so they can be careful for themselves. But if you see somebody that's walking around and they don't look like they're being too careful with their health, then maybe just give them a wide berth.
Yeah. And if you're alone,
Requirements, we're not requiring, the university has not made a requirement for wearing masks. And it may make a person who is wearing a mask uncomfortable, but as Captain Trosclair said, probably just giving that person a wide berth and maybe extra social distancing.
Yes, yes.
Although I would just add that if you're listening to this, I think it's a good idea if everybody were to wear a mask when they go out. That's my PSA for the day. But so we sort of talked a little bit about that the campus isn't requiring it, which sort of leads me to think about when we'll have a full return to campus. I don't know that we have the answer to that, but I'm sure it's on people's minds. So I don't know if anybody wants to sort of take that and sort of what we're, some of the steps we're taking to think about that.
I know that the university has put together some committees to work on what it would look like when we do return to work. I think that as of right now, the President Fitz has said that he is adhering to Mayor Cantrell May 16th, I believe it is, return to work. But whether or not the university is going to be fully back at work at that time, I would highly doubt it. I'm sure that it will be a phased in, and that there'll be lots of communication from the university on return to work.
Yes, I think that's a good point too. And certainly we'll be assessing all of our facilities, both downtown and uptown, to make sure our buildings are safe and ready for the workforce to return, because that's one of the key points, we need to make for people to understand that we want you to come back, but we want it to be a safe environment.
So all of this is all we've been talking about people's physical safety, but I think a lot of this is about anxiety as well. And the anxiety about just ourselves and feeling unsafe generally. And I know the schools are all doing things in that area. And I don't know if we want to start with Arturo to talk about, I know school social work, but I think all the schools are doing things. So we'll start with Arturo on that one.
Thank you very much, Sharon. Yes, I mean, I've been talking to our dean. He's been very active out in the community, and so have our faculty members, talking about the stress and the anxiety that is coming forward. But I think one of the things that we've done also is we've put together a website that has all sorts of tips of well-being, how to handle all the social isolation and whatnot. So I don't know if it's going to be on Facebook, but it's if you type self-care tips tulane.edu, it'll take you right there. We have we're always updating the content. It's a site about wellness, about self-care, and what can we do? What have we as staff have done to kind of take care of ourselves mentally during this difficult time.
And the School of Medicine Facebook page is constantly being updated with information, both scientific and non-scientific, around the same areas of what individuals and families can be doing. And I would bet that public health has something too.
Oh yes, this is perfect for public health. We pride ourselves on being on the front lines, and we certainly have been, both in the community and at large. I don't think a day goes by and one of our faculty are probably not in the media some kind of way, and hopefully relaying good, useful information and trying to keep the best information out there. We had some donor funding that's allowing our students to go out and do some community projects that they'll be launching soon, whether it's delivering food or art projects or any type of thing. We've funded several projects. The dean's working on a campaign to provide education to the African American community.
Okay.
The rate of death among that group has been tremendous. And so the lack of resources, information, healthcare, that's one of his things he's really interested in trying to go out and educate on, and several other projects. So I think with everything we're doing, I hope we're making a good impact on the community.
And I would remind the university community, the downtown university community. The university is also updating its website and Facebook pages with information on a regular basis.
Right.
The main university homepage and get very good information.
Right. We also produce it's called the Outbreak Daily that the School of Public Health is putting out there. Has a lot of good information, collection of a lot of different information sources. So if you haven't signed up, I'd encourage you to go to our COVID website and sign up. Dr. Fauci even signed up, so he's interested.
Oh, wow.
So that's pretty impressive for us. Yeah. Yeah.
If I can, TUPD also does our community policing unit, has Facebook, has our website, as well as Instagram. They're letting people know about any incidents we may have had in the areas, things like that, scams that are going on at the time, and any kind of safety tips they're looking for. They can go onto those websites.
That's good. I didn't know that. I just learned something.
So I'm going to go to a few sort of basic safety questions that we have. So what is the safest way for people to move between buildings?
Quickly. No. So the safest way would be TUPD escort, but obviously that's not always convenient or needed. So you can go on our website, look at the recommended walking paths. You could use Everbridge, which is an app that Tulane University provides, and it can do a virtual escort, which basically you tell it you're leaving, you tell it where you're going, and then it calls us if you don't make it there, and then we come look for you, and we can track you by GPS. So if you have somebody that doesn't want to wait for a police car, but wants some level of security, you can use Everbridge. Walk-in groups, obviously, is always a bonus. Certainly, avoid dark areas of campus, which fortunately this campus has done really well in the last 3 years with improving lighting. It is almost like daytime when you walk around some of these buildings at night, and that is just awesome. Uptown, there's some lighting issues, but we've really done a lot to kick that into high gear down here. So I'm really happy about that. But if anybody is ever uncomfortable at all, just call us. It's really not worth it walking out into something that you're unsure of to save a few minutes. So
If somebody sees something that they think is off, what's the best way for them to reach out to you guys?
well, obviously it depends how off that thing might be. If it's just maybe some minor security concern, a light bulb burned out, maybe a camera is missing, or people hanging out in an area and you just want somebody to check it out, you can call the regular dispatch number, which is 504-865-5381. And that's for on-campus stuff or near-campus stuff, and that would be within that footprint that I talked about. If you're outside of that area, you are going to need to call the New Orleans Police Department, and the best way to reach that is 911. You can also use, if it's something that you want to let us know about and maybe you don't want us to know who you are, you can use the Silent Witness page on Tulane's website. That is an anonymous reporting app. The issue with it is, if you don't give us a lot of information, we have no way to follow up with you. So if you want to use Silent Witness, make sure you give us all the information that we need to check out whatever concern it is you have.
I'd say if they have information, don't wait 2 or 3 days, call then.
Yeah.
The sooner we get it, the better we can do with it. If it's something that's actually happening, then 911 or that other number, at least get someone there. If it's like Maurice said, basic information, we'd still like it at that time that you learn it, and we can do a whole lot more on that end with that then than we can a week down the line. And we had to wait 1 and 2 weeks to call. So
yeah, that is an issue we've had in the past, is delayed reporting of crimes. We're already at a disadvantage sometimes to solve crimes because sometimes there's no evidence. If you wait 2 weeks, video evidence is gone, physical evidence is gone. You can take what's already a difficult situation and make it an impossible situation to solve. So I would rather get 100 calls that really could have waited than risk losing that one call that gives us something that helps make the campus safer or save somebody from being a victim. So don't ever feel like you're, inconveniencing us. I mean, the entire reason that Tulane maintains a 100-person police department is to prevent crime and provide security for Tulane University. Why not use it?
I want to mention too, because we might have some patient care providers listening in, that TUPD works very closely with the police forces that are at the VA and at UMC. And so if you're at one of those facilities and report to one of those particular police forces, TUPD will be informed and can participate and assist in any follow-up.
Yes.
So in my job, my day job, where I'm not a town hall moderator, I often get community-based questions. And one of those questions has been about the Uptown campus and the signs on the Uptown campus about the campus being closed. So people want to know, can they still ride their bikes across campus, and can they still walk across campus with their dogs?
yes, they can. They absolutely can. The only persons allowed with the quad and to have small activities of the students or faculty that's on campus. Anyone else or non-affiliates, neighbors, they're still welcome to walk through, walk their dog, ride their bike, come through. But it's that, walk through and keep going for right now.
So that sort of kind of takes me back to both the mask question and the lack of social distancing question for both of you. So we're not requiring people to wear masks, but if you see a group of people, whether it's downtown or uptown in sort of a cluster, does TUPD break that group up?
We've spoken to a few and asked them to disperse, and they have. We haven't had any problems, and that's probably only been 2 times uptown that I'm aware of. I'm not sure we had that downtown, Maurice.
We haven't had any of those reported to us. And basically it's the same thing if we have that downtown, as we'll just ask them.
Yeah.
If they're in an area where we could legally ask them to move on.
Right. And if they're on Tulane property, we can legally ask them to move.
Right. And there's not a lot of green space downtown, so not a lot of gathering areas.
No, there's not. Lots of gray.
In the event that someone is approached by somebody with a gun, how should someone handle that situation?
I'd say cooperate to an extent. You don't want to, I think the way that the issue on the 7th was handled was pretty smart by those two victims. They walked away. They tried to keep their distance, and actually in the end turned around and spoke with them. Fortunately, the gun was never pulled and pointed at them, so that makes a big difference. If somebody is actually pointing a weapon at you and trying to tell you, the best thing to do is give them what they want and report it later. I would say if they try to abduct you, that's when you fight. You don't go anywhere with them. But every situation is different. You can never plan out what exactly is going to happen depending on the area, the circumstances, how many actually confront you and things like that. So the best thing to do is cooperate and try and end it peacefully and walk away. And because most of them do not want anything. If it's an actual robbery, they're looking for property. They're not looking to take anything from you. You fight, you argue with them. That's when things can go bad. So, but again, if they're trying to take you with them, that's the time to fight.
Do we currently offer any self-defense classes?
We had RAD up until, I guess, maybe 6 months ago. At this time, we do not. There's some information on self-defense and things that you can get on our website. And then there's also numerous places in the area that you can take those classes. Well, not right now, but that's something we're trying to work back into our plan, but we just don't have it right now.
So the RAD program got discontinued because the way it was structured, there wasn't a whole lot of buy-in from the community. It was difficult to get enough people to commit to come to a class that we were unable to hold the classes. So we're actually working on our own in-house program. It's going to be much shorter, maybe a day or so at the most, and it'll be structured in a way that more people can participate. COVID has kind of put the brakes on a lot of stuff that we're working on, and that was one of them. But it is something that is still there, and it is something that is going to come back around because we do need something to fill the place that RAD has vacated.
And how do the schools handle informing their faculty and students every semester or at the beginning of the fall semester about security tips? Do they send them to a website? Are there mechanisms that you guys use to give people tips? This might be TUPD, it might be the school reps. I'm not sure who should answer this question.
Well, I don't believe we participate in orientation anymore, do we?
No, they took us out of that.
I'm not really sure how that information gets passed on now.
I'll tell you, at least for our school social work, we, and the orientation, we provide all the information necessary to contact the TUPD. We stress Everbridge quite a bit, and that's for students. Faculty and staff, we have regular meetings and a couple of times a year whenever it's either necessary or whether something like this happens. I always stress, you know, our connections and our with TUPD, Everbridge, how to call, where to call, those type of things.
I believe that the TUPD does participate or have at least a short session with the incoming graduate students. I know that there's a short session with the incoming residents. And I believe that they also do some things with the med students when they start.
And in public health, our orientation does involve a safety and emergency preparedness piece. We invite the Office of Emergency Preparedness to the orientation to talk about hurricane preparedness and general preparedness activities. Because, you know, this is the first time a lot of them have been in New Orleans, and for some of them in the US. So it's a good opportunity to get a captive audience with them. And then with faculty, TUPD was with us, I believe it was in the fall semester of 2019, this past year, an active shooter training, which we really appreciated.
Right. And those are happening by request. That's through emergency preparedness, and our community policing division are doing those by request. So
I do notice that Lieutenant Barnes is monitoring our town hall and had a few notes, including that TUPD provides information disseminated through video orientations and will conduct in-person orientations as the department requests them. Thank you, Lieutenant Barnes. If people have suggestions for TUPD, where should they send those? And I mean, constructive suggestions, hopefully.
We're okay with criticism also, as long as it's articulate and polite, obviously, but we'll listen to it either way. It would depend. If it's specific to a district, I would want downtown stuff to come to me, and then I can figure out how to handle it. If it's just a departmental issue, then probably it would be Deputy Chief Saucier.
either way, I'm available.
Or if it's somebody that's on the Uptown campus, Captain Patrick Martin is my counterpart on that end of the city. So.
So we've covered a lot of ground, and our even though we have a lot of people listening, apparently you guys have covered everything. There aren't a lot of questions coming in, but can you guys think of anything that we haven't talked about that we should mention? If not, I'm going to ask my favorite question of everybody. Nothing says we have to go an hour, but take your time if you want to with these questions. So the thing I asked everybody, and I think it's got to be something that for you guys, when you think about this area too, what's the thing that sort of keeps you up at night when you think about the security of our campuses and your students? And we'll start with Maurice. Sorry to put you on the spot first.
No, that's fine. I'm used to it. That's part of this position. What keeps me up at night is the not knowing. I can plan for a lot of things, but like the incident on the 7th, that's not something that I went to bed knowing was going to happen the following day. There's no way that, that I didn't imagine that we would have that type of issue here. It's stuff like that. Yeah, I know we're going to have, cell phones get stolen, and I know that cars are going to occasionally get damaged or broken into, or, somebody will lose a bicycle, which actually, let me knock on wood, because we don't have a bike theft problem on this campus. I can say that. I can say that very loudly. We do not have a bike theft problem on this campus. But it's the unknown stuff, the weird stuff keeps me up. Like what's going to happen, this month. It's going to be bizarre, and it's stuff like that.
I think for School of Medicine, it's how can we manage the perception of whether or not someone is feeling safe. I think we have a wonderful police department, and that they do a very good job, but I don't think it's always appreciated because what folks remember is that last incident that happened, and it's how can we help and manage the perception of our employees and our trainees feeling safe and protected in this environment. That's my biggest concern, because I think we do a good job of keeping the campus relatively safe, and it's how can we help people feel that?
Yeah, I think building on that is making sure that we we have the do that, right? To make sure TUPD has enough officers and has the resources to keep us all safe. It's a big campus between downtown and uptown, and sometimes resources are stretched thin, and so making sure that there are the resources there that we need to keep everybody safe. You know.
I would just add that, you know, on the downtown campus, you know, there's a lot of different variables, and it's a tidewater. You're walking right on the Canal Street, and you don't know who you're going to meet. You don't know who you're going to see when you step out that door. And so I think it's important to just remember your surroundings, where you are. And that's very important, because, you know, you're in an environment that's just changes from the one time you walked out a little while ago to the time that you walked out this time. And keeping an awareness level up regarding your security, I think, is also important.
That's good. I agree.
I'd like to say that I'm with Captain Trosclair. I mean, you don't know what you don't know, and that is really what keeps me up at night. But also the fact, also, you know, no matter how many times we say these are the numbers that you call, get your Everbridge, get, you know, we say it constantly, but I still don't. It's a stressful situation if somebody is approached or followed or whatever, and sometimes you don't have time to fumble on your phone and whatnot, or sometimes people panic and whatnot. So that is what kind of concerns me. I want to make sure that we follow procedure, we follow the advice of the TUPD, go to the phone, call, get one of the blue lights, whatever that may be, and make sure that you inform TUPD.
I guess I finished this up, huh?
Well, I have one more question, but you're going to finish this round.
I kind of track with Maurice. I've been in this business for over 40 years. You cannot plan for everything. It's impossible. But trying to keep up our numbers, make sure we have enough officers in the right spots for major incidents that may occur. You know, I hate to use the word a perfect setting, but and when things are going normally, we've got thousands of people uptown, we've got thousands of people downtown. Something kicks off, that our guys are there. We have enough people, enough officers to handle the situation and get it done quickly and correctly. And that's what we plan. We try and plan for everything. We just can't. But that's what worries everybody.
Well, I always like to end these on a more optimistic note than just what keeps you up at night. So everyone has that thing, but I think everybody also has like the thing that you're most pleased by in this area, and most impressed by the things, any changes we've made or just progress you've seen in different areas. So one last round robin, and we'll start with Sue to talk about sort of like, what's the thing that gives you the most hope for, like, you know, how we're handling all these situations and how well it's done?
Well, I'm sorry that COVID had to make it happen, but I'm glad that some resources have been directed towards the downtown homeless population, and that the homeless camp and those individuals now have better resources than to be living on concrete under an overpass. That's been a good outcome of this. I think overall in the past couple of years, we've done a very good job downtown. Captain Trosclair mentioned the improved lighting. We got the shuttle service to be able to move back and forth between the hospitals and the main campus here in a more secure way. many things have been happening that I think have contributed to the reduced crime rate as well as a true improved sense of security. And I only see that continuing.
Yeah, I think they'll build on that too. Having the signage on all the buildings and making it really a downtown campus, I think has been key. I think people generally feel better about moving around in that perimeter, you know, overall.
Yeah.
And seeing the TUPD presence helps that, and the allied people. So I think it's much more of a closer knit community, you know, in terms of the footprint.
I thought it was the question was geared towards, you know, what regarding this situation, what we're thankful. I'm
It's okay.
thankful for all of the things that both Sue and Susan said. I'm just really impressed and proud of all our faculty, really, that have moved quickly to ensuring that our students receive their education online. I've had faculty members, you know, really learn Zoom very quickly.
Yeah.
And so I absolutely love the fact that we, and not only us as a school of social work, but all Tulane has moved so quickly and efficiently and without a lot of trouble. And same thing for us as employees. You know, the operations have been moved very smoothly. And I applaud the leadership for that. And I'm grateful and I'm thankful for that.
I'd just like to say thank you for all of those staff, faculty, and TUPD, Allied, for being there at this time as well. You know, the computer labs in Tidewater have stayed open, as far as I know, the whole time. The mailroom has been open. There have been services that have been functioning, and so somebody's been going and, you know, operating, and trying to keep things going, and I just really want to thank them. And I also just want to thank Captain Trosclair for, you know, your communication with the school. It's been, I think it's been really an improvement, and I think we feel like we can just reach out to you whenever we have a question or an issue, and you're very responsive. So thank you for that.
Thank you. I guess I can go next since Tom kind of handed it off to me. And in that vein, you know, I'm new to this position in the sense that I was promoted in February, but I'm not new to Tulane or to the downtown district. I've been here since 2007. Been in law enforcement since 2003. I started here. I went uptown for a little while, only 4 years, so it doesn't really count. But you know, this is what I'm comfortable with. This is the place that I know, and watching how this district has evolved. As when I got here, it was, we have a building here, we have a building here, we have a building here. Now, this is Tulane downtown, and the signage, and you know, the banners, I guess, whatever you call those things on the sides of the buildings. It feels like a campus now compared to what it was when I started. And security and police-wise, we've come so far. When we merged in 2012, and now we're accredited, and we've got more people than we've ever had. It's it feels good to work for a department like this and be part of this bigger entity. So that's what I'm happy for.
Well, now me, and I'm gonna tail off of what Maurice just said. Over the last year and a half, I've been here since 2007 myself. Over the last year and a half, we've seen growth within our numbers. A lot of that had to do with Chief Boyalis coming on board and being able to fit in and really let the university know what we needed. Morale's increased, and we were really bringing on some quality people, and I think that shows. I think, and as Tom said, everybody that's working right now, I think a big round of applause ought to go out to them because they're keeping this place going. Just if it wasn't for this incident right now, we'd probably have at least another 4 or 5 officers on board and getting really right at that number we're looking for. That said, I think the folks that are here, they're here unless they're something drastic, are doing a great job. They're trying, and we're pushing it forward. And I know the chief wanted to be here. Some unfortunate circumstances kept him from coming here on this call, but it's working well, I think.
All right. Well, I want to thank all of you. I know that everyone on this call and everyone across campus is really loading up on the other duties as assigned on our job descriptions these days in this environment. But so thank all of you for your work. And I really want to thank, TUPD, first responders, being out there on the street at a really difficult time. So thanks to you guys for being part of our panel, and thanks for everyone who watched us online. And we'll see you at our next town hall. Thank you.
Bye.
Bye.